So we need to get a stomach surgery done. Can I go
None
down?
of us.
Yeah, so I go down the street, should I just go to my local hospital where there's a general surgeon?
Bariatric surgeons?
Yeah, should I get a stomach clip at the same time? What would you say about just picking your surgeon?
Yeah, it's as with anything, experience matters, and the higher the volume, the better. And there have been a number of studies that have looked particularly at esophagectomies, more so than with gastrectomies, where the volume of the institution matters, but also the volume of the individual surgeon. Now, it seems that the effect is a little bit less with gastrectomy than it is with esophagectomy, but there still is clearly a benefit, particularly if you're going to move beyond a D1 resection. So really, it would be ideal if a surgeon is comfortable performing a D2 resection. That really can only be performed in centers with sufficient volume, surgeons who are trained specifically to do these. In Japan and Europe, they're much better about doing this than here in the United States. And it's embarrassing, the studies that have been completed here, how many suboptimal surgeries are performed. That's getting better, but I think that we're gradually moving to D2 resections at all of our academic centers, but for that reason, one really should avoid the community general surgeon for this type of a procedure.
And really quickly, the D2 resection, can you explain the...
Oh, it's not so easy to describe that in words, but basically it's the number of lymph nodes that are involved, and it's broken down into D1, D0 through D4, and it's the number of lymph nodes that are removed immediately around the stomach, and then as the lymph flows away from the stomach, there are additional stations that can be removed. The Japanese have been really the pioneers in doing these more aggressive resections, but really it is, most people would think that a D2 resection in skilled hands would be the current standard of care.
And you take the spleen in the D2 as well, correct?
Yes. Splenectomy with or without splenectomy was compared in randomized trial, but actually there's no
benefit.
Oh, so you don't have to, so you guys are just modifying right
we
now?
also in Europe do a modified D2. That's an extensive lymph node resection, but without a splenectomy. There are some data that the splenectomy in this situation doesn't contribute.
Yeah.
And also very importantly, previously D3 resection was also tried in Japan as a randomized trial, published in New England Journal of Medicine, but it could not show the superior outcome. So D2 is the standard.
So more is not always better, probably sort of sticking in the middle.
And one thing I would just add is that you shouldn't force your surgeon who doesn't routinely do D2 procedures to do it. So if you can't make it to an academic center and this surgeon performs a D1, you shouldn't force them to do a D2, because as the Dutch study showed, there was really a prolonged learning curve that occurs, and if the surgeon's not comfortable doing that, then you're probably better off just doing the less optimal surgery that they're used to doing.